You're listening to The Voice of Reason. I'm Dr. Len Zaputo here with Francesco Garapoli. We've got a very interesting show for you today because the doctors are finally getting together. And they're not just the doctors who are doing alternative medicine. These are doctors who are in charge of major medical centers when it comes to the emergency rooms and critical care. And it's nice to see them getting together and coming out with some kind of statement.
It really is. These are frontline people. And, I am more from the Eastern medicine, holistic medicine, as you are, integrated medicine side of things. But our Western allopathic doctors are fantastic, and they've got to deal with really tough issues. And all of a sudden, they're put front and center right now in this COVID-19 story.
Yeah, well, for sure. And what they've got is it's called a Frontline Critical Care Consortium. And it's got the professor of medicine from University of Tennessee, a guy named Dr. Menduri, somebody who's the director of trauma and life support at the University of Wisconsin, Pierre Corey, professor of medicine and pulmonary critical care, Eastern Virginia Medical Center, professor from Seton Hall. These are all professors. There's 7 of them from different places who are even from UCSF in San Francisco, somebody who is really supporting this. And they say, look, there's treatment out there that's not being used, and we feel like we should wake up. What's going on? All this emphasis on waiting until we have a vaccine before we come out of this this lockdown is nonsense.
Yeah, it's time these voices are heard, because they're very easily squashed. They're very easily put down by the American Medical Association. People are afraid about their license. There's a lot of peer pressure. But we've got to hear these voices, at least hear them equally. This is what we're not hearing. We're not hearing equal on the table together opinions and voices. That's the only way we learn.
Right.
So we're getting one side, and then it's being pushed, and then another side's being pushed. I want to see this consortium really come out, and then in good faith, the whole medical community taking a look at it and saying, maybe there's something to it, because that's the only conclusion they can make.
Well, I think doctors have been figuring this out now for a couple of months. The doctors in New York, where this pandemic or this epidemic in the U.S. was the worst, they started using things like IV vitamin C and hydroxychloroquine. And the results that they were reporting were really surprisingly good, for at least in terms of what the mainstream of medicine thinks. And they weren't getting the kind of attention at the National Institutes of Health or the CDC or the FDA. There's no research being funded for it. The National Institutes of Health has the obligation of representing the people of this country and the doctors of this country. They should be doing the research. When we can't get funding from Big Pharma, which is 2/3 of where the funding for our research comes from, it's got to come from NIH, and it's not happening. They're putting little token experiments out there that aren't even being designed very well, and they're not coming up with the big guns that we have that we know are working. It's not right.
You have to see who's influencing the NIH. And when hydroxychloroquine was first brought out and showed that it had some efficacy in dealing with COVID-19, Fauci immediately came out immediately and said there isn't enough information to prove it so. On a solution that has 70 years of history, with studies that are irrefutable.
Yeah,
why would he come out with a response like that if he's supposed to be a doctor and he's supposed to be intelligent?
Well, maybe he's got a conflict of interest, which is what it's looking like. In the earlier shows that we've done, that's exactly what we've seen. And he's in the middle of this thing with Bill Gates, where they're waiting for the vaccine. And most of the information that we're seeing that's coming out from the experts who designed the vaccines are saying, look, you shouldn't be doing this because these vaccines are dangerous. And they're part of the reason why we're having the problem that we are. And it's been now almost 20 years, since the original SARS came out. We still don't have a vaccine for that. So now, what are we going to wait? Another year or 2 years until the country is in so much debt that it collapses, and we're all indigent people? That's where it's headed if it continues like this.
Well, the sad thing is, when you see these doctors, the consortium of doctors and other doctors, start looking outside of what's right in front of them, and say, why was Italy hit so hard, so fast and early, only to find out that a new vaccine was perpetrated upon northern Italy, exactly where COVID hit the hardest.
Yeah,
Is that a surprise? I
it
mean,
was an
this is
influenza
fact.
vaccine. That's right.
Yes. Read about this, people. We've got to find out that this isn't conspiracy. These are real facts. And it's making these doctors, I think, empowered enough to be able to come out and to make a stand.
Well, the literature shows that if you take a flu shot, okay, last year or this year, your risk for getting a coronavirus goes up 36%. It's
Look
like,
what's in the vaccines,
and
for
then they're
heaven's sake.
telling us that we should go get our flu shot this year. It's like, we're not stupid, and people are beginning to understand that. And so that's why we're starting to say, where's the NIH and the CDC and the FDA and the World
Right.
Health Organization, and what's going on with Fauci and Gates? This is an immoral situation, and it is. Now, the treatment they're coming out with is really pretty straightforward. It's using steroids, which are anti-inflammatory, a little bit of heparin, which is an anticoagulant, because it seems like there's a lot of thick blood that develops. It clogs up the lungs so that they can't get oxygenated. Using IV vitamin C in relatively low doses, 8, 10, 15, 20 grams a day, and hydroxychloroquine. And they're saying, look, this works. If it's done early, people aren't dying from it. And so they're reporting that. And we need to
not
pay it.
putting people on ventilators, for heaven's
That's
sakes.
right. It says, wait to do the ventilation. Try to solve the problem first. Putting a tube in somebody's lungs isn't going to help them with oxygenation if there is no connection between the alveoli and the bloodstream because of blood clots.
Exactly. It's like pouring a gas hose at the gas station into your gas tank, but the cap is on it.
Yeah, there you go.
So
That's a good example.
But that example is important because this is what came down from the top to hospitals around the country on what to do.
Yeah,
the absolute wrong treatment.
Yeah.
Which really created a lot of, what do we call it?
Iatrogenic. That's right.
Iatrogenic disease, which is what doctors do to kill people in treatment. So it's very, very sad.
Yeah, well, it is. Well, the doctors are waking up. These people in New York. And also, the results from China, Korea, Japan, and Italy show that the steroids alone in this particular illness, it wasn't for a lot of previous illnesses like influenza, but for this particular illness, the steroids alone decreased mortality by 50%. And then you add the IV vitamin C, the heparin, and the hydroxychloroquine, and maybe a little zinc. Nobody's going to die from this disease except the people who are really the ones that are the suffering the most from other kinds of illnesses that they have as well. So these are the people that are in the rest homes, in the convalescent hospitals.
Exactly.
But not the young people for the most part. And the numbers would be way smaller than what they are. So we're in the right direction here. And I want to take my hat off to this Critical Care Consortium and hope they continue to do what they're doing. And they can reach out to the doctors and say, we hear you. We're going to support you. And if they do, what's going to happen is we're going to see even better results than we've seen. And there will be a lot fewer deaths. You're listening to The Voice of Reason. I'm Dr. Len Saput here with Francesco Garipoli. We'll see you again tomorrow. Thanks for listening.